Billy Joel on the new Mix 107.3 KGRS. It's Mix Mornings with Darren. Good morning to you. Happy Thursday. And just in case you were unaware, April is Donate Life Month, National Donate Life Month. At any given time, more than 100,000 patients are on waiting lists for an organ, including a friend of mine. And my wife and I were organ donors as well, so I figured this was a great opportunity to talk about it. I got Dawn Clayburn in studio, Director of Critical Care Services for Great River Health. Good morning.
Good morning.
Thank you so much for taking some time and talking with me about this. This is something that I think is super important. I know a lot of people know that organ donation is a thing, but they might not know the nuts and bolts about it. They might be, concerned or maybe even a little creeped out about it, depending on where you're coming from in life. But so I wanted to get off base, starting with that number, more than 100,000 patients in the U.S. waiting for an organ at any given time. So if I find myself in a situation where I need an organ, the doctor says, I'll use my friend's example. She's waiting for a liver. What is the process like for a patient? How do they get on that list? What's that look like?
The majority of the time, these patients are being seen by their physicians, and they go through the process of testing and everything. They are put onto the organ donation list by their physicians.
Okay.
And they refer them to whatever entity is in which state. So
Sure.
Iowa actually is the Iowa Donor Network. So they are referred to them. And the process goes from there as far as the outpatient side. The inpatient side, which is more where I work at, we have patients who come in and have, life-threatening brain death, prognosis, and those people, when we decide that that's where we're at, then we contact Iowa Donor Network, and they come in and start working with us, the patients, and the families.
Okay. Now, I think I've heard from other people that sometimes it's a matter of getting your personal health to a certain level before you can receive a donation. Is that right?
Correct. That's more like for the outpatient side.
Sure.
Definitely. I mean, they work with the physicians, the Iowa Donor Network.
Gotcha.
Those other donor in other states, they work with them.
Gotcha. Well, if someone's interested in becoming a donor, because, it's a question we get asked every time we renew our driver's licenses. Would you like to become an organ donor? If someone is interested in doing that, I know there's the driver's license route. Are there other routes that we can take?
There are other routes. Actually, IowaDonorNetwork.org.
Okay.
You can get on there and register. And, like you said, the majority of people all know the driver's license, but IowaDonorNetwork.org is a good place to also go to register.
Okay. All right. Cool. So what's the process like on the donor side of things? Like, I've signed up to be a donor, as I mentioned. Is a hospital just going to reach out to me one day and say, hey, you got a spare kidney, or how does that work?
Yes. People who, like you, who donated, a lot of times it's family, or they've decided that they want to give that gift. So they work with the physicians, but they also can work with Iowa Donor Network to be able to donate.
Okay.
And then the families, of the patients, they work with Iowa Donor Network also for that at that end also.
Okay. So, there's a good chance that you could just be contacted if that's something where, it's an organ that you can survive without.
Correct.
Okay. All right. Just
Correct.
wanted to make sure. So cool. Well, I mean, and now obviously for everyone listening and watching, everyone is different. You might have different concerns. You might have different questions about organ donation, that kind of thing. That's totally fine. But who should they reach out to if they've got those questions?
Definitely Iowa Donor Network is a great place to start with and to ask any questions. They can answer any kind of questions that you have.
Okay. All right. And we'll put some information up in the description on our video as well. And Great River Health is another great resource. Dawn, thank you so much for coming in today.
Yes, thank you.